normally, and then I'm going to check. Okay, let's go.
Okay, is that working? I'll be clear. Slow.
Okay, so let's see.
Okay, is that working?
Oh,
I hate hearing my voice about everyone's
Thank
life.
you very much.
It's
So
strange,
let's
right?
start.
It's very, that's not how I sound.
Yeah.
It's like how we hear ourselves, right?
I know.
Yeah.
Okay,
Because my
let's go.
husband does do media production, I would help him with things and do like a voiceover for him, and then he'd be editing it. I said, you have to put headphones on, I can't handle hearing myself.
What's your husband name? Channel?
He just does freelance, so he has his own business called Missing Piece Media. So it's just his own little company. So, yes, which is good because it means he gets to drop our kids at school and have some flexibility. It works well. Okay, so you know who I am and what we're doing. We always like to start with acknowledging the traditional owners of the land. So you will have done this, I think, a few times this week. We're on the land of the Kumameri people, and we always like to pay respect to the traditional owners and respect their elders, past, present, and emerging. And this is something that's obviously we all have seen it as something that's really important for us. That we're acknowledging that they have looked after these beautiful lands for us for such a long time. So, just to give you a little overview, so what we'll do this morning, like I said, we've got the teaching on the run modules that we'll work through, and that's hopefully a really good insight for you into what we can offer. I've also got my folder here of all of the teaching on the run modules, so if you're interested in having a look at some of the other ones that are on offer, feel free to have a look in the rates as well. I'll start with just a bit of an overview of some of the principles that I think are really nice to be aware of when we talk about what is the fundamentals of university teaching and learning. And then we'll do the first teaching on the run module, which is the planning learning. At lunchtime, I actually have to go to Gold Coast University Hospital because we're doing our evaluation of the CPC program. So I'm going to run off and do a focus group with some students. But Michelle Jack, who you've met, will come and do this one. So she'll do the clinical teaching module. She'll be here with you at lunchtime, as will plenty of the others. And then I'll come back again. And we'll do the skills teaching. So mixes it up for you as well and gets you a bit of exposure to the, some different styles and approaches. So, just really quickly, what teaching experience do you all have, if any? You do some supervision?
I have participated to clinical training since about 20 years, and on the theory teaching at university about 10 years. So.
Okay. So you've
Yes.
been just part of that formally or more informally?
And so, what could this mean?
So, do you supervise students when they're on clinical placement, or do you have any experience teaching them, like delivering lectures or that sort of thing with them?
Yes, that's
More like lectures.
Yes.
Okay, sure.
Yes.
So more like lectures.
But importantly, so I started for both clinical training and theory teachings. So directly, when I was a doctor, doesn't mean I have not absorbed any course about the teaching skill training and things like this. Because most of my college
students. Yeah, fair. Sure. Yeah.
I have been teaching about two years now, and at first this is mostly about clinical teaching, and now around 1 year, really, I teach technical.
You teach the.
I teach in the university.
Okay. Yeah. Great.
I have started teaching since 2011, so it should be 15 years by now.
Yeah.
But I teach in university, no clinical yet, because my background is from public health.
Okay.
So I teach public health students and taking them to the field. So that's what I have experienced before.
Yeah, and so more again didactic, lecture stuff.
Yes.
Sure. Yeah.
I'm not a
clinician, so the experience I have also is university for biomedical science subject and some like practical experiment in the lab. So it's a little difficult, a little different with the clinician that I have both for the theory in the class and then practical experiment in the lab.
In the lab. Yeah, that's great. And that's again like quite different to delivering a lecture or a forum, but equally, you know, important, and a lot of the foundational skills apply across both. That's good.
My field is quite diverse, but just junior, so have 1 year being like a teaching assistant, and then 1 year for clinical coach for the physiotherapy, and then just currently being a lecturer, like formal lecturer, so took away the class like lecturer.
And have you had any training as well, or similar?
Yeah. We had like I have certificate for like national teaching training just from Vietnam, it's not international.
No, that's good. That's really good. Yeah.
So my background is preventive medicine, so I have instruct students on some public health subjects in my university. So I don't have much teaching experience because I'm just junior.
Yeah, great. So we have a mixture. It's just good to get a sense of who's in the room and what levels you're all at. And of course, everything that I'm doing is actually part of, you know, those fundamental things that you want to do when you've got a room of learners, and establishing first, you know, what's the baseline, who are we working with. So you've all got a little bit of experience as teachers, but you also, I'm sure, can recall days when you were the learners. What sorts of things would you say make a good teacher? And write some of your ideas.
So I think the first thing is we should know what student needed from the teachers.
Yes. So what are the goals? Expectations. Yeah.
Expectations
Yeah.
from students.
Yeah. So I'm writing knowing expectations. We're a little bit far away from that. Yeah. What else?
I think the second thing is like good preparation. So
Yeah. Yeah. Never good when you think the teachers just run in and doesn't know what they're doing for the day.
Just freestyle.
Yeah.
Communication.
Yeah. Absolutely.
Empathy.
Why is that important?
Because we have different level of students in the class, and we need to know what should we do to engage all of them into the class.
Yeah, absolutely. And recognizing where each of their struggles and strengths might be.
And notice the difference.
Yeah.
So have SNP, social learning, planning,
Yeah.
yes, and the preparation. So
Yeah, so acknowledging differences and structured learning and planning, you said.
yeah, social learning planning.
Messy. What else? Cultural, aesthetic.
Inspiring.
Yeah, inspired, passionate. My 11-year-old currently, he has dyslexia and dysgraphia. He struggles, like, so he's smart, and as in, if he gets interested in lots of things and he can understand things, he's got a great memory. I read aloud with him a lot, and he remembers the story in a lot of detail. And he will tell you a really creative story, but if you ask him to write it down, he really struggles. But of course, if I or his dad try to help him, it just ends up in arguments. So we've recently started with a tutor, and it's really funny listening to the conversation. They sit at our kitchen table and I'll be in the background cooking dinner or whatever. And he requires, I think, patience, empathy definitely, understanding, hang on, why? This is a simple concept, why are you struggling? He's not, you know, querying or just trying to think different ways to ask a question and encouraging him to think differently. But I think he's also doing like that inspiration of like trying to connect on a personal level and trying to help him see why it's important to learn as well. So, and it's worth the investment because my son is still smiling at the end of an hour and a half instead of maybe 10 minutes and an argument storming off if it was us trying to help. So this is good. Are there any more?
Maybe I can talk about teamwork. Teamwork,
Yeah.
because some lessons is at least more than one teacher.
Yes. So, do you mean like teamwork with teachers?
Yes.
Or with between teacher and learner? Both. Yeah, I think that's a really good point that it's like a partnership. Actually very similar to being a healthcare provider. So when, and particularly say with communication skills, when I teach communication, one of the big things that I try to emphasize in all of the fundamental ways we want to communicate, we want to teach communication is this, and the way we interact with our learners is actually the same way that we should interact with patients as healthcare providers. And if you apply those same principles of, we talk about partnership, you know, patient-centered care is about a partnership between a doctor and a patient. Well, learner-centered approaches to teaching are about partnerships between the two and discussions. So it's not about that hierarchy of, you know, we used to have the phrase, you heard the sage on the stage. It's like the educator who comes in their robes and they, you know, just preach to the audience, but that's obviously not what is going to resonate and build relationships with students. So I think we got lots of these. These are just some of the ones that we had, you know, we come up with previously. So yeah, being organized or prepared. Obviously we need some knowledge, but actually it's interesting it didn't come up so much here, and it's often not the first thing that we think of, because education can be about guiding learning. It doesn't have to be about delivering information. So we use, and I'm not sure if your university uses problem-based learning or that kind of structure, but that's very much a case of we actually deliberately don't use doctors with our first couple of years of medical students in problem-based learning, because doctors tend to want to explain because they have the knowledge, they want to teach it and they want to share it. Whereas we use people with other backgrounds, lots of physiotherapists, and they've got lots of health backgrounds, so they can bring knowledge, but what they're a bit better able to do is step aside, and it's about guiding the learning, it's about asking the right questions to guide the learning. So knowledge isn't number one. Being likable and approachable, so it's that relationship, definitely. Good communicators, you got that one. Structuring the learning, making things relevant, I think that's important. We get lots of feedback from our students, and when they have anything that they feel isn't directly connected to them, as in if it's not directly relevant to becoming a doctor one day, they think, this is a waste of my time, why am I doing this? So I think showing them, because there are lots of things that actually are related to that, but they don't see it yet. And so just making sure that you can show that and demonstrate why things are relevant. Making the learning interactive, so asking the questions as well as just the telling. And I think a safe learning environment is a really important factor in that as well. So we talked about like empathy, that's about making every learner in the room feel like they can ask questions, they can say when they don't understand, feeling safe to do all of those things is very, very important. So that's just some of what we had come up with, and I think you got there as well. What about what makes a good learner?
Curiosity.
Yeah, great, yep. What else? I'm going a different colour. Respect. Yep.
Reflection.
Amazing.
Self-discipline.
Planning.
Yeah, and now we're getting onto the same things, right? So it's like planning and preparation.
Okay. Maybe about passion.
So being a
Passion.
yeah, being actually kind of associated with this, right? Passionate, inspiring. They're kind of similar.
It's
So
different between the passion and motivation.
motivation, yeah, absolutely. Yeah, so they kind of line up in a way. What makes a good learner is quite similar in many ways to what makes a good teacher. And you know, we look at collaboration, well that works if you're willing to collaborate. And we have obviously learners at different levels. So we, in the Bachelor of Medical Studies, in our undergrad program, we tend to be more, you know, we are tutors. So we will teach students in a small group. Sorry, I keep moving around, my cursor is, I need a pointer. We teach students in small groups and they see us as, they do see a hierarchy, a power imbalance. And that's hard to avoid. I mean, we're giving them feedback, we are assessing them, so it's difficult not to have that situation. But then when students move into the MD, there's still a hierarchy of course, but we do some things like an MD research project where they're almost, as a supervisor of an MD research project, you're almost more like a research collaborator. And suddenly students have to get used to working with you as part of a team as opposed to as your as their supervisor or their assessor. And so that's quite a jump for them. But really trying to establish those foundations of teamwork and collaboration right from the beginning, and that feedback can be a two-way thing. I think an openness to communication and teamwork from the learner as well can be really helpful. What do we have? Yes, I think we got most of those things. So being prepared, willing to be challenged. I think that's something that's really so that comes down to you have their motivation and passion, and I think that's willing to work hard and it's willing to be challenged. They're engaged, they're willing to ask questions, and they're good communicators. So lots of others too.
Yeah, so about the work hard and to be in the challenges, so it's also the risk of the burnt out, do you know?
Yeah, absolutely. So when I say work hard, I think it's about, I mean, as you said as well, planning, being prepared.
Yeah.
So we need students to do that. We need them to be engaged. It's about an appropriate level of challenge. So one of the things that we use and think about in terms of student sort of safety is this idea of, again, it does come a little bit back to burnout as well, but it's particularly about that level of challenge. So if you think about hard work, challenge as in content and difficulty of the knowledge that they need to gain, and then safety in terms of the environment that you provide for them to learn in. So if the challenge is really, really high but the safety is low and you're down here, then the learning is not going to happen. What you want is high safety and high challenge. Appropriate challenge, not like right up here, maybe too much. But in this area here is like a sweet spot of learning. So if you kind of look at it as a trajectory like this, we don't want to be down here because it's like we're not learning anything, we're not challenging them, when they're not getting outside their comfort zone. It might be material they've already covered. It's not pressing them. But we need to make sure that it's safe. And so if you challenge a student in an unsafe environment, the learning won't happen either. So challenging them in an environment where they feel safe and supported. So doing communication is a good example of that, because we ask students to do role play. They do interactions with simulated patients, with actors. So they get up in front of their peers and they practice taking histories and things like that with patients. And that can be really confronting. That's a lot to ask a young student to do. But that's why it's so important that we create that safe learning environment. And we do that by setting the expectations really clearly. We do it by providing feedback in a way that's supportive and encouraging. One of the things that I often do in communication skills teaching is give them a chance to try again on something that's been difficult. So you might have an interaction, they'll take a history, you have some feedback conversation, and they will, you know, it might be, oh, this question was a bit clumsy, the patient didn't appreciate the way that was asked, or it didn't get the information that you were trying to get. How could we do it differently? And you can say, would you like to try that again? And when they practice it and they do it and succeed, then they feel like they've succeeded in something and they've kind of had a win, as opposed to feeling like this and walking away from a session feeling like a failure and then being scared to come back next time, because that was really confronting for them. So that's the sort of thing that you can do to make sure the safety's high, but that also it's an appropriate level of challenge, and that you are pushing them to do something that isn't necessarily what they're already good at. So this is like the utopia, the goal sort of spot in there in terms of where we want to kind of be. But yes, I guess that also relates to the burnout in terms of if they're constantly having to push and feel uncomfortable, that's when they'll get burnt out. But if they're being motivated by walking away from sessions feeling like they've learned something, then I guess it energizes as well. So again, it's all about balance, I suppose. So a couple of the other things just to sort of highlight, I thought it might be useful to give you a little bit of an orientation to some of the key principles that we think about as educators. So in terms of what drives us, so right at the top here, I've tried to group this as sort of, these are almost like the external motivators, the external drivers on the left-hand side. And then this is how we actually operationalize that in a medical program. So we're driven to a large extent by accreditation standards, by what we need to make sure that we address. So we've just been through our re-accreditation process, and there are, you know, reams of standards that we need to speak to, and we need to submit a report to show that our program addresses each of those standards. So that's a pretty clear external driver. What I guess leads into that, and one of the big sort of influences on that is just career readiness. So the AMC standards, the Australian Medical Council standards, are all based on preparing learners to be interns and junior doctors. So yes, that's that career readiness. What does every single learner need in order to be able to be an effective intern? And then we think about clinical priorities and core conditions, and this can kind of be on both sides as well, because we use that as a driver when we're asking ourselves curriculum questions like which example should we use if we're coming up with cases, coming up with examples for SGL, PBL type cases. One of the key things that helps us choose between this condition and this condition is to really think about what the priorities are. So what are the core sort of conditions that every intern should know about and or then know how to manage. So we've done some work, and a colleague who previously worked here at Bonds did some research doing like a Delphi study to establish what are the core clinical conditions and what level do students need to know that information. So is it just know about, I need to have heard of a condition, versus right up to, I need to know quite a lot about it, how it works, and also how I would manage it clinically. So there's that sort of spectrum, and so that helps us kind of think about that, you know, foundational, these are the things you need to make sure you cover, and then of course the foundational science that is required to understand those things. So that's, I guess, the drivers from the, like, what do we need, and then how do we take all that and go, let's create a medical program. So again, all of those things feed into our sort of graduate attributes, and then we work down into what we actually build. So we take that foundational knowledge and think about that, build the curriculum around that, but then also make sure that we're including a range of teaching approaches. So we talked about different kinds of learners that you might have in the room, different base levels of experience and knowledge. And so we need to make sure that we're using a diversity of approaches as well. If we just use all didactic, it won't work. If we just use all experiential, it'll be really unsafe and uncomfortable for some students. So we need to make sure there's a mixture. Of course, it's very much driven by the learning objectives, the outcomes. and that will lead into the discussion around planning learning in the next module as well. And the learning objectives, again, are at different levels. So we sort of have our graduate attributes, big overarching statements, but then at the next level down is, okay, well in each year, so if this is what we need by the end of the program, what do we need in year 5, and in year 4, and in year 3, and where do we start? But then even, okay, these are across a year, but it might be understand, the science of different body systems. So then we need to go down into, okay, well in each body system, what are the actual objectives that we need, and then come to session level learning objectives. So we have learning objectives at each of the different levels. So for the overall year, right down to in each session today, what am I trying to convey? And then of course the assessment of knowledge and skills. So how do we know that our learners have actually achieved that? We're grappling at the moment with AI, as is the universe. And so we've had this big shift away from assessing. So it used to be that you'd say you can't use anything, just don't use it. When AI first came in, we said it was banned, don't use it. Now there's a recognition that we can't ban it. We know that students will use it anyway, and it's here to stay, so we can't pretend it doesn't exist. So assessments are being either, we do have some assessments where AI use is prohibited, but those are assessments where students are invigilated, or it's a written exam and they're being watched and we know that it's controlled, or an OSCE, like a clinical exam, where there's observation. But everything else has to be sort of AI supported. So that means that we know they can use it, but we want to try and assure that they are doing the learning. So we're flipping things so that we change some of the assessment approaches so that the students can actually demonstrate the development of their work and the development of their thinking. And we're not assessing the quality of their writing, because we know that they could have just put it in ChatGPT and made writing that wasn't particularly professional or grammatical and make all the corrections. So we don't give them marks for that, but we give them marks for demonstrating that they are developing that learning. So we've had to really adapt with how we assess, that's the thing. But we do really need to authentically assess and be fairly confident that learners do actually have the skills and the knowledge that.
So the first teaching approach sometimes have a challenge if there are many students in the group with different backgrounds. What should we do to solve this challenge?
Well, and this is where I guess we, the allowance of AI as a tool, it can create a more level playing field. So if we say we have lots of diversity, and so we have lots of students whose first language is English, and whose writing is quite good, is already very professional. But what we're really saying now is the students for whom English is a second or a third language, they shouldn't be disadvantaged anymore, because they can use AI to support the actual writing. So it is actually in many ways better, because we're able to assess whether they've got the knowledge and they're developing the skills. It's not about their English proficiency, it's about what they're actually demonstrating. So hopefully it is actually, because it's been something that's been quite scary, I think, for lots of people who think, when AI first came around, there was this real fear of, but how can we ever be sure that students aren't just cheating? But I think as long as we're using it appropriately and we're being really clear and explicit about how students should use it, like how it is appropriate to use and how they shouldn't, and as long as we can stay within those bounds, then we can create that level playing field for the diverse learners, hopefully. So yeah, I guess this is just we talked a little bit about this already, that sort of learner focus and thinking about the different diversities that you've got in the room, and so just being conscious of that. We have, as an undergraduate entry program, it's quite challenging, and this is something that I faced in my previous role at Newcastle as well, where you've got some learners who do come straight from high school, and then you've got some learners who have a previous degree, but we have to, it's an undergraduate entry, so we have to sort of appeal to the lowest common denominator, so that those who have come straight from school. But it's not just about knowledge, it's also about life experience. So, you know, we have some students who are parents and who are requesting change of classes so that they can leave and go and pick up their children from school and those sorts of things. And then we have others who are still learning how to wash their own clothes because they've just moved out of home and that's their biggest challenge in life. And so the diversity of just life experience is huge. Hello. Do you want to? Yeah, let's bring it over that one. Thank you. So that's something that's really important, I guess, to think about as well. So we definitely make sure that we have a mixture of forms and modalities. So different types of learning. I'm not sure if you've met Dr. Mike yet. He's famous. YouTube famous doctor, and he does lots of really great YouTube videos and recordings that students love. But he's also brought in lots of interesting things like different technologies and video pods and all sorts of different ways for students to engage in their learning, which is great as well. And when I say consider the neuroscience of learning, I really just mean we learn, and we know increasingly the younger generation, they don't have the attention span to sit through lots and lots of just being talked at. So we have to do things in snippets, shorter blocks and that sort of thing. And it's not actually, if we say it's this generation, I think it's just that we are also more aware of it. Screens and social media haven't helped because we've sort of enabled that a little bit. But definitely it's real, it's been around since we were probably all learners, but we just had to deal with the fact that, I sat through lots of very, very long, dry lectures, but I couldn't tell you now what most of them are about because it obviously didn't stick. So I don't think it's necessarily new, it's just that we're more aware of it.
So the question is, how do we know that it is the best teaching approach?
Well, this is the thing. I don't think there is one best teaching approach. So I think it's a case of a mixture for depending on the learners, as in the level, like the starting point, and the content. So I would always say there are different, like courses for courses is a phrase that we use. So for different types of content, different types of skills, there are different ways. So even today, we're going to work through different things. And so this afternoon after lunch, we'll do skills teaching, clinical teaching with Michelle. And that's more like a micro teach, or a concept or a didactic thing. And then when we do skills teaching, it's more of a practical thing. And so those two are separate modules because there are different ways and different frameworks for teaching those different types of content. So I teach communication skills in a very different way than I would teach, a theory of health behaviour. So it's I guess a different, depends on so many factors. And also just on the level. Some learners love and respond really well to things like game-based learning as well. Some hate it. And I think we see this in schools. Increasingly, there's a diversity of ways of addressing things, and you'll see, group, like even what my daughter has just started prep, so her first year of proper big school, and they tend to have things set up so it's sort of like stations and group work in their room, so they accept that they might be learning the same concepts, but different students and learners will resonate with different ways of explaining concepts. So they'll be covering a similar topic, but they'll have stations where they're addressing it in different ways. Some might be drawing to get a concept. Some might be using blocks and building something. Obviously this is very early learners, so it's different, but those same principles I think apply. There's no one right way. Constructive alignment. These are a bit of an array of different concepts that I'm sharing, but this is one that I just want to make, I guess, really clear because I think this is such a foundational thing that a lot of us who are medical educators and have a little bit of training take for granted. We do have morning tea, so we'll finish in a minute if you want to stay.
No.
Thank you. It's something that we take for granted. But then we realise that we bring in people, just like you've all had the experience of employing clinicians to come and teach who haven't had the training. And so this is something that I think is just a really fundamental, useful concept to share. And that is constructive alignment. So we talk about alignment of the learner objectives. So what are we trying to achieve in any particular session? And you can do this at any level. So it can be a whole semester, a whole subject, a whole year, or it can be just a session. Like today, what am I trying to achieve? And of course, there's a whole science in that, in developing learning objectives which are clear. Have you guys heard of Bloom's taxonomy?
Yeah.
Yeah. So the language that you would use to develop the learning objectives that make sense. And then of course you've got your teaching activities to address them. And this is where you go, well, for these learning objectives, I might use these kind of activities, and then for these ones, I'll use something different. So it will vary across your different types. But then of course, it's about how do I actually assess and assure that the students have addressed those learning objectives. And again, the assessment types might change as well. So for some of them, it will be Latin-Oski, I will need to observe the skills. For some, it might be an exam with multiple choice questions. For some, it might be a written essay, all sorts of different things. A project, like a public health type project or research, that sort of thing. So there's a whole range of different things.
You're mentioning to the conducting teaching activities, right? I mean, that's not build up the content. Because about the build up content, I have heard that. So we begin at the learning objectives and then assessment and then the content, right?
You mean you would go assessment first?
So build up the learning, build up the content, or in general, the build up the curriculum. And the first, the learning objective or the outcome,
Yeah.
and then the assessment, the way to assess this outcome, and the finally is the
the how.
Yeah.
Well, I
And
would
this-
argue that I guess these
alright.
two can be planned at a similar time. Because again, it's similar with research,
Yeah.
where you always plan a research project with the evaluation in
Yeah.
mind, right?
Yeah.
How am I going to know if this works?
Yeah.
And I guess the planning, it has to happen together,
Yeah,
because
yeah.
okay, well, what is the thing that I want to observe or see or
Yeah.
know that they're getting, and that will drive both of these things. So I
Yes.
think definitely starting here, and
Exactly.
then planning wise is kind of together.
Okay.
But sequentially, in terms of what we do, we then deliver, then we assess. Of course, with programmatic type assessment,
Yes.
we are actually assessing often like along the way. So it's not just one big assessment at the end,
Yes.
but it might be that you have checkpoints where you assess the
Yes.
development as you go, which is also very helpful and important if you can build that in.
Yes. Listen again. So this is suitable for organized teaching activities.
Yeah.
That's mean so we know the learning objective. We tell students, okay, you have this objective, and then we teach them.
Yes.
And finally, we assess the step in the middle of the section.
Yeah.
But about the setup,
Yes.
the content, the curriculum, so
Yes.
correct
As
is
in-
my question.
Who's doing this bit?
And then the way to assessment, and finally we build up the
Yes, exactly. And I guess that's coming back to this, where who's doing that
Yes.
kind of setting up with this comes first. Is
Yes.
that and that is then driven by all these
Exactly.
things. Like so, it's kind of that
Yeah.
that whole cycle of what, starting off with the what
Yes.
do they need to know, and all of the questions around what do they need to know at each level. So
Yes.
if they need to know this much
Mhm.
and be this good at it by the very end,
Yes.
how can we start? Like what's expected standard at year 1 and year 2 and year 3?
Yes.
So that can go
Thank you,
in
yes.
stepwise.
Mm.
This can go wrong in lots of different ways, and so I
Mhm.
guess these are really common mistakes that are made in programs where we might have some objectives and we might teach, but then not assess. So we never know if the learners have actually got there.
Exactly.
There are some things that get taught and assessed, but the learners didn't know that they needed to study. So obviously that's where you get lots of complaints, because learners say there was a question on the exam and I didn't expect it because it wasn't in my list of objectives. These ones are even worse, where there's no teaching, so there might be some objectives and some assessment, but we haven't provided any guidance as to how to actually.
Self-learning.
Yeah, exactly. Self-learning is fine,
Yes.
as long as they know that they need to do
Yes,
that.
for learning.
So even if this is an instruction that they should go and do some self-learning. Sometimes we go a bit too heavy on this, like in terms of just that weighting, so balance is important to be thinking about. We would think about blueprinting for assessment, so if you look at the volume of learning in the different disciplines that the students might have, then that needs to reflect the way we would assess and ask the questions, but sometimes we get that wrong, and the weighting of some areas in assessment is heavier than others, so it should balance the teaching. And then of course sometimes we go a bit too heavy on assessment with not enough emphasis here. So those are just some examples of where it can go wrong. And I guess just a final point to sort of show you, so you've seen, you know about Bloom's taxonomy in terms of developing learning objectives. This Miller's pyramid is often used more in the assessment realm to understand what level we're really trying to assess our learners at. So obviously we tend to start at knowledge, and this is where your MCQs and those sorts of things fit in. When we start to get into skills, initially learners need to know how, and so sometimes we are, even an early clinical skills assessment would be regarded as a knows how, because they're really just showing that they can, but they're not showing that they can in action, in context. So that's where this would then go into more of a contextualized clinical placement, might be a workplace-based assessment, where they're doing a skill with a real patient or in a more simulated kind of environment. Going through the sort of those steps right through to the action in clinical placement. And this is one that has identity added. So this I like this because it shows that ultimately we're trying to produce doctors. That's what we are, other health professionals as well. But of course, that's not just a person who has a lot of knowledge and skills, but it's a person who is a doctor. So it's about taking on that professional identity of doctors as well. So I think that's just it includes all of the things like the values, the ethical behaviours, the professional behaviours that go beyond knowledge and skills that can be tangible. A little bit harder to assess, of course, in terms of how do you measure that. So that's one for further discussion in another day, but that's something that can be helpful in sort of guiding which assessment matches which type of teaching to.
So based on this, the previous slide, choosing like the knowledge, skill, and the attitude. So the attitude is the highest level and we want to achieve.
I think it's all together. I think that's the thing. So for me, the identity is all of it together. It's you're the person with the skills and the knowledge and the right attitude. So it's kind of not separating, and that's actually what this shows as well. So it's about trying to bring it together. So we tend to operate in silos. So even in our medical school, we're driven. These are our 4 domains in our curriculum. 4 domains. So we have.
You have London and your documents.
Yes, and this
We all
is driven by the AMC accreditation. So science and scholar, clinical practice, professional and health and society. So these are our 4. But of course, we're actually producing one graduate. Like every individual graduate has to be all of these, and I think that's where it's like the identity thing as well. Is actually it's all of it, and it's not saying that this is more important than that, but it's about this is part of one of the things. So our students have been doing core. So students at Bond across every other program do what's called core subjects. So there's a critical thinking and communication subject. So students in every law, business, everything do these subjects. And then there's one that's responsibility, it's ethics and civic responsibility. So these subjects were previously everybody else except medicine. And last year we introduced that medical students, we integrated those subjects into our big integrated medical subjects as well. It's interesting because so far some of the feedback from students is this isn't relevant to me. It's taking me away from my medical studies. And even with
I study medicine.
yes, why am I studying critical thinking? And also we have a portfolio. So we've started a CPD or continuing professional development portfolio with the students. And even that, they have lots of work, lots of tasks to do. They say, this is taking me away from medicine. But what we're trying to say is this is part of medicine, and it's part of that bigger picture. That it's actually, we're helping you to develop. It was previously referred to as almost the soft skills, but it's the other stuff. It's kind of, for me, it's like it's the fabric that holds it all together, or what's the right analogy, but that's certainly the way we're trying to explain it to the students, that this is part of that, and it's
But you know the estimate percent at the time for every domain in total, the 4 years 8 months?
yes,
You know?
yep, so,
So what is the highest percent of the time?
so most students will do it in the 4 years and 8
So
months.
in the folio, so how many is it? Estimated percentage at the time for every domain that students spend to study in the total 4 years?
Yeah,
8
well,
months?
so we have, in each subject, the workloads that we
Okay.
put together, and it does balance out a little bit, so it's probably heavier in the science
Yes.
in years 1 and 2, so
Yes.
the hours based on timetable teaching, so they have, 8, so they have like 4 hours of SGL, small group learning, they have, say 8 hours of science in a week, and then they might have, 3 hours of clinical practice, and then 1.5 to 2 hours of like the health and society and leadership. So that's the proportion, but then there's also the self-directed study behind that. So probably it's heavier weighted, like it'd be, where's my pen? More weighted towards science here in year 1. So if you're going year 1 to 5, more of the science and less of the other, and then gradually it tips so that this is then the clinical starts to take over. So we sort of have a wedge, so balance, but still with the other things, you know, going along the way.
Okay.
But yeah, definitely clinical flips like this,
Okay.
and it's the increased work time. So they get like a little bit of structured clinical history taking and physical examination skills early, and then the science kind of tips down as they go in. Okay.
Sorry, what does scholars mean?
Science and scholar. So scholar is like learner, like
Yeah.
scholarly activity is like a learning investigative activity. Yeah. So.
The doctor must become the teacher and
Yeah, so it also incorporates, so that domain incorporates the basic science, so all of the basic science disciplines, anatomy, physiology, pharmacology, but it also incorporates like critical thinking and research. So that's the scholarly part, so the investigator, the person who is not necessarily a researcher, they could be, but a consumer of research. So a scholar as in someone who can read and consume and interpret research.
Researcher.
Yeah. So that's been really good. What we might do is pause, we can have some more chat, there's a little bit of morning tea, so if you'd like to grab something, I'll change the slides over and we can start on the next part, which is the planning learning.
Yes.
Did everyone, before you do that, did you all see the the online modules?
Yeah.
Everyone had a chance to get organised? Yeah. So what we might do, because we'll get through this, and I'm hoping to leave you a little bit of time before lunch to get ready then if you need just sort of half an hour or so for this afternoon, because that's when we'll do Michelle will do the micro teach one with you, so if you each got something, you don't all have to, what we would normally do with these is if we had a bigger group, split into groups and have, some people present in one room and some to another, but are you happy to just stay together and have all together? So even amongst yourselves, you might like to decide who we might be able to fit two to do the first one, the skills teach, and maybe 2 to do the clinical teach and the micro teach, and 2 to do the skills later this afternoon. So I'll give you a little bit of time before lunch to organise. Is that okay? Yes. Get ready for that? Okay, so grab some food and I'll get this ready.
Could I turn off the micro to save the battery and then we turn on again? Thank you very much.
Bộ nhớ. Đây bộ nhớ này.